Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jacqueline Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. The information is not to be interpreted as or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, or treatment.
So today's guest is Dr. Tracy Gapin. He's a board-certified urologist, a renowned men's health optimization expert, and founder of the Gapin Institute. After 25 years of practicing traditional urology, he now focuses on practicing data-driven, holistic men's health and providing programs that help men optimize their health, performance, and longevity. We're really excited to have you here, Dr. Gapin. Thanks so much for joining me.
Oh, thanks so much. I'm excited to be here with you today.
So we have such an interesting topic to cover today, which is that a lot of men are so high performing in so many areas of their life. And yet when they come in for an evaluation, they realize that they've really missed some kind of critical components for their health and longevity. You know, many can be elite athletes, C-suite executives, fitness enthusiasts. So they assume that they're in great shape with things like cardiovascular disease, given how much heart disease how much physical activity they have going on. But tell me a little bit about, why do these men think that they're in optimal health, especially in terms of cardiovascular health, but still have undiagnosed risk factors?
Oh, it's so common. And, I want to be really clear, first off, that cardiovascular disease is the number one cause of death in men and women by far, by a long shot. The number one cause of mortality, without question, is cardiovascular disease. And a lot of guys think that that's a problem for when I'm in my 60s, 70s, 80s. But to be clear, it's a problem that develops when you're very young. In fact, it's a decades-long process, starting even in your teens and 20s. We know that atherosclerosis, vascular disease, which is really the foundation or hallmark of cardiovascular disease, and we're talking about heart attack, stroke, blood clot, and sudden death, starts at a very young age, and guys don't really realize how important it is to pay attention to that at an very early age. And let me give you an example of what I mean by this. Most doctors, when you go in for a typical physical exam for your annual, they're going to do your total cholesterol, LDL, HDL, triglycerides maybe, and they're going to tell you based on that, you're normal, you're fine, don't worry about it, or, oh my God, your LDL, the bad cholesterol is a little high, you need to be on a statin. BS, nonsense. Those are barely scratching the surface. And what's much more important are some other markers that every guy should be checking. So I'll give you a few of those that drive home this point. Apolipoprotein B, or ApoB for short, is the single most important predictor of cardiovascular risk. ApoB is a marker that's on every single atherogenic or bad particle, if you will, that's carrying cholesterol in our body, has one ApoB attached to it. And so ApoB is a magnificent, perfect way to measure the number of particles that are carrying cholesterol in our body. Now, I want to be clear. When you have LDL-C on your lab report, that's LDL cholesterol. That is the concentration of cholesterol within your LDL particles. And the analogy I make here is you have these submarines in your bloodstream. These submarines are carrying cholesterol around your body. LDL happens to be the most common type of submarine, but we have other ones, VLDL, IDL, for example. And ApoB measures all of those bad submarines, if you will, that's carrying cholesterol to your body and ultimately depositing that cholesterol into your blood vessels where it matters. And so ApoB is a great marker that everybody should be getting checked. LDL particle number, particle count, LDL-P, not LDL-C, which is the concentration of cholesterol. LDL-P is the particle number, the number of LDL submarines or particles you have in your bloodstream. So important to get that checked. So many guys I see, they think they're doing great and their markers are through the roof and their LDL cholesterol or total cholesterol doesn't tell you that picture at all.
So I have so many questions already.
Yeah.
Now, let's start with the fact that a lot of this cardiovascular disease happens younger in years. So what are we seeing in men when they come into your clinic? Are you seeing kind of decades of, I'll just say, abuse of our bodies, right?
Yeah.
And then you have this recovery period where you start to pay attention to performance. later in life, but you're trying to kind of undo damage. Is that what you're kind
Yeah.
of
Yeah.
what you're seeing mostly?
So many guys are doing great. They're doing fine. And I'll give you a perfect example. And I love to tell this story because it really drives this point home. Bob Harper. Bob Harper is the lead fitness trainer on the TV show, The Biggest Loser. Now, he looks amazing. He's in great shape. He's teaching people how to lose weight and get in shape as well. He's the epitome of good health. We all aspire to look like Bob Harper. Then how is it that at age 51, Bob Harper had a massive heart attack that almost killed him? Well, the answer is he had a massively elevated LP little a, and that looks like capital L little p and then little a in parentheses. LP little a is a subtype of LDL that most doctors don't know about, don't ever check. It's a hidden risk factor for cardiovascular disease, and you inherited it. It's one that's genetically inherited from your parents, and it's not lowered by a statin. It's not lowered by exercise. It's not lowered by eating a clean diet. We could talk a lot about what that even means. This is a great example of how I talk about blind spots in our health. And these are great examples, whether it's ApoB, LDL particle count, or LP little a. These are blind spots that men need to know about at a very young, early age because it changes what you need to be doing. Bob Harper was the epitome of good health, yet he almost died because he didn't realize this blind spot was right there in front of him, and his traditional doctors had no idea either.
Yeah, that's so scary because you think about someone who probably had access to great medical care and, did all the things that
Yeah.
your healthcare provider, whether it's a PCP or cardiologist, would have
Right.
recommended. Eat
Right.
well, exercise, stay fit. Maybe stress was his culprit because it can't be an easy thing to be the
Yeah.
lead trainer on The Biggest Loser. But clearly there's some diagnostic tests that we're missing in our routine eval. And that's one thing that you really specialize at the Gapin Clinic is focusing on a more functional panel of cardiovascular tests. So I'd love for you to share a little bit about what blood panels, genetic markers, diagnostic tools you're
Yeah.
using that really differentiate the care that you're providing.
Sure. So I have a 4-step process. First is diagnostics, which is really looking at the comprehensive blood testing, because I believe that's where everyone should start to find those blind spots that need to be addressed further. So from a cardiovascular standpoint, I want to be really clear here that we focused on lipids, but cardiovascular disease is not caused by just lipids. In fact, a lot of people have significant cardiovascular disease, but yet their lipids are normal. How is that possible? Well, the answer is that cardiovascular disease is not just all about lipids. It's about inflammation, systemic inflammation, as well as metabolic health, which is a fancy term for blood sugar regulation, insulin sensitivity. We're not just talking about being diabetic. We're talking about how well are you regulating your blood sugar. All of those come into play when we look at how does cardiovascular disease develop. And so I gave you some examples of lipid numbers. We look at for inflammation, things like CRP, which is C-reactive protein, or myeloperoxidase, or LPPLA2. These are 3 markers that your traditional doctor doesn't even know about, doesn't know what they mean, doesn't ever check them. And these are great markers to look for signs of inflammation. Ferritin is a great marker that most doctors think of, that's a measure of iron. Well, it is, yes. It's also a measure of inflammation.
Yeah, we see
And
that a lot. It's crazy that, you see that elevated iron and they think, oh, it's either hemochromatosis or it's just your normal. It's like, no, there's this
yeah,
massive in between.
right. But it's a big deal, and it gets overlooked. And traditional healthcare, disease model medicine. That I'm embarrassed that I spent 25 years as a urologist stuck in that matrix of disease focused care. I realize that they're missing the boat on this. So they're not looking at the right lipid markers. They're not looking at the right inflammation markers. And then when it comes to metabolic health, there are some short-term markers of metabolic health, such as fasting insulin level, which again, most doctors don't ever look at. Insulin is the best way to understand how well is your body reacting to and regulating fluctuations in blood sugar. So
Mhm.
fasting insulin should be low. It should be preferably under 5, definitely under 8. I see a lot of guys with fasting insulin of 15, 18, 20. It's way too high. That means your body is struggling to regulate blood sugar. And again, that's one of the hallmarks of aging. It's the hallmark of cardiovascular disease. Hemoglobin A1C now is more of a long-term marker. And what I mean by that is our red blood cells regenerate, replenish every 90 days or so. You make new red blood cells, old blood cells go away. And so I like to describe them as cornflakes. Your red blood cells are like cornflakes. And when they become coated with sugar, like frosted flakes, they're glycosylated, it's called. They're covered in sugar. And we can measure that. And so hemoglobin A1C is literally measuring your frosted flakes when they should be cornflakes. And we don't want to see a lot of sugar-coated red blood cells. And so great way to measure at a long-term level how well we're doing with regulating blood sugar.
Now, I've never heard that analogy, but I
I made
promise
it
I
up.
will never
I
forget
should
it. I
patent
will
that.
never forget it. It's a perfect analogy. I love
Thanks.
it.
Thanks.
So I want to spend time talking about the science, but you did mention
Yeah.
something about kind of this transition from conventional urology care into this more holistic functional practice. And,
Yep.
our audience is providers. And I think we always are, reassured by physicians like you who come to the light, right? To kind of see this broader
Yeah.
picture. And of course, I say that because conventional medicine has really important aspects that it offers with life-saving disease management types of
Yeah.
care. But
Yeah.
I would love it if you could share a little bit about what led you to take more of a functional perspective and also, to transition out of a urology specialty
Mhm.
into a more generalized picture. I imagine it's because a lot of urology problems stem from cardiovascular disease. It's one of the first signs that
Yeah,
we see.
you bring up a great point, and I was a very busy urologist, private practice, 5-man group. I was doing robotic surgery, treating prostate cancer in the hospital at night, doing kidney stone, treating kidney stones and doing vasectomies, bread and butter stuff. Um, about halfway through my career, I had this really sudden wake up call when I was 40 years old. So I'm 52 now. So 12 years ago, I went to a local concierge doc. I never had a doctor before, but now I'm 40. I should get a physical exam, whatever that means, an annual exam. I'm like, yeah, I'm fine. Get me out of here. And I had some blood work done, and holy cow, eye-opening moment when my creatinine was high. It was 1.4. My liver enzymes were a little off, but the biggest problem was my cholesterol. My LDL cholesterol was 140. My total was 225, I think. I was about 30 pounds overweight suddenly. I'm like, I don't know how I got to be this fat. I was stressed out. I wasn't sleeping well. I was so focused on my career that I had neglected myself. And we had a new child, our first boy. And I suddenly came face to face with my own mortality when this concierge doctor friend of mine is telling me I need to be on a statin and mortality numbers. And I'm suddenly like, holy crap, I need to pay attention to this. At the same time, I was very humbly embarrassed that here I am as this, men's health expert. I am the urologist. I'm like a pioneer in robotic surgery and minimally invasive prostate cancer detection with MRI guided biopsy and minimally invasive treatment with HIFU. And I'm this amazing surgeon. And here I am, I'm a mess. And that got me to start going down rabbit holes. I started going to, it started with a certification in epigenetics, which is, the science of how our lifestyle and environment affect our genes and how our body works. And I got certified in epigenetics, reading genetics to understand how to influence lifestyle factors. That got me into functional medicine. I went through some IFM. I went through Kalish Institute. That got me to WorldLink Medical, where I went through hormone training and realized, holy cow, I had no idea how to treat hormone issues. And in urology, they don't teach you that at all. Not one day in urology training did I ever learn about hormones. I kind of just picked it up on the fly. So I realized I was doing everything wrong when it came to hormones. I wasn't looking at the hormones that need to be addressed. That got me into this space of longevity medicine. That got me into A4M, American Academy of Anti-Aging, got me to Age Management Medical Group, and I'm doing all these certifications. And I'll swear I suddenly fell in love with medicine again. And I realized how freaking miserable, how unhappy I was in my career. I was at this point where I'm making 7 figures. I'm doing great financially. It's lucrative, and what more could you ask for? But I was miserable and I was dying inside, and I wasn't fulfilled. I didn't feel like I was, even though I'm treating prostate cancer, I didn't feel like I was having an impact. And so I started putting all these pieces together that I was learning selfishly for myself to get healthy, get in shape, and really fix my own health. And that got me to realize that for me, everything is being a dad. And I'm going to try not to get emotional here, but having my son, it changed everything for me. And it got me to really focus and pay attention to what matters and what's important. And I was like, I'm missing out because I'm in the hospital every day and every night. And it made me really shift my priorities and realize that I don't want to do what I'm doing anymore. And I'd rather walk away from this career than miss what's ultimately most important to me. And so I did what any crazy person does, and I walked away from a lucrative practice and started from ground zero.
Mm.
And I launched Gapin Institute. And that was I want to be clear, that was not an overnight process. That was a many years in the making. And I formally opened it 4 years ago now, but it was 8 years building to that point where I can formally step away from urology. And so any of those medical doctors listening to me out there, I'm happy to talk to you about what that process looks like, but you don't want to jump off that cliff until you're ready. And I was at A4M in December and spoke to this urologist from the Panhandle, Florida, who had already left his urology practice trying to do what I'm doing.
Mm.
And there needs to be a process to do it the right way. It's not an overnight success. It's a 12-year overnight success, basically,
There
to
you
get to
go.
where we are, And
Yeah, it
so,
looks like an overnight success, but no one can see the preparation that goes
yeah,
into it
yeah,
behind the scenes.
yeah. And the real difference is I'll honestly say I freaking love what I do every day now. And I couldn't say that before, but I love what I'm doing. It's cutting edge. It's awesome. We're saving lives. We're having a much bigger impact in a very different way. It's a very different type of business model, obviously. But the passion and love that I bring to it now shines through in everything I do.
I'm really grateful for you taking the time to share your story. And I got chills when you said I fell in love with medicine again, because,
Yeah.
it's really a common experience and thread, and I pursued naturopathic medical school, but looked at conventional, but found myself like on fire with the things I was talking
Yeah.
about, even in my application for naturopathic school, the nutrition and lifestyle medicine. And I felt grateful that I took that path,
Yeah.
because I hear from physicians like you who are doing amazing work in science and medicine. I mean, you were saving lives. You were doing so much there to really help people, yet it wasn't feeling fulfilling to you.
Right.
And I think the ability to interact with people now, with patients now, the way that you do, it's such a different experience, right? Because
Yeah.
you are igniting. You're like just a candle who like passes the flame
Yeah.
on, and you see that light up inside someone else. And that's that
Yeah.
part for me, at least, that's so rewarding, is like
Right.
you give someone a kernel or a crumb, and then they run with it because they're so thrilled to
Yeah.
like learn more about nutrition, learn more about fitness,
Yeah.
whatever it is.
Right. And to take it a step further, and I'm going to make some of the docs out there jealous with this. I can count on one hand how many patients I personally see. So I built a team around me. I built a medical team. I built a functional coaching team. I built a team of genetics experts and technology experts and concierge team around me so that I can have that bigger impact. And that takes more time and training and building, the whole, training module around how do I build a team. But that allows me to have a much bigger impact. And instead of being in an exam room with one person right now, I can reach millions here with you today. And I couldn't do that if I was still a clinician. And they talk about working in your business instead of on your business. Well, as a doctor, it's very tough to work on your business if you're the primary person seeing patients. So to any doctor out there who's listening to this, open your mind to the idea that it doesn't need to be you in that exam room seeing every single patient. You can build a protocol. You can build an approach that is your expertise that is spread through many and through your disciples, if you will. And that's how we're going to have a much bigger impact. We can't reach every person out there if we do it one-on-one. We have to build a team around us. And that's what it's really going to have the biggest impact.
Yeah, and surely I think some people feel nervous about that because they want to be held as the expert, right? But there's so many people who need our help that I absolutely think you're right. The more people you can train to work with you, work with your patients, you get that ripple effect. You can only touch so many people in,
That's right.
your
That's right.
work day.
Yeah. And I built a very clear, like a system, an approach, a method to my madness from my years of training that I have built into a model for my medical team and my coaching team that they follow. And it continues to evolve because science changes every day, right? We're learning new stuff. And so we continually add upon that. But there's still that foundational element to it that my team adheres to and adopts. And when clients come to Gapin Institute, they know that they're not getting me personally. They're not going to see me in that exam room, but they're getting that approach and that method. And that's what they ultimately trust.
Yeah, that's fabulous.
Yeah.
Great. So I know I kind of took you on this massive diversion, but thanks for coming with me on
For
that
sure.
trip.
Yeah.
And I think your son is lucky to have a dad who's so committed to
Thank you.
like the massive change of life that you must have made, and how much courage it takes to leave a growing career when you're really in your prime.
Yeah.
to like support a child is pretty amazing. So kudos to you as a
Thank
dad.
you.
Um,
Thank you.
let's pull it back to the work that you're doing with patients as well. So you said you were starting with the serum testing. We talked about
Yep.
A1C,
Yep.
fasting insulin, a lot of the kind of cardiovascular markers and expansion
Yeah.
on the traditional total cholesterol, HDL, LDL.
Yeah. So on that first of the 4 steps is diagnostics. We've talked about some of the blood testing we do. Some other ones that are really important to emphasize would be hormones. And when it comes to men's health, which has always been my focus, my passion, testosterone gets all the attention, of course. But I want to emphasize free testosterone is what you want to be checking. So total testosterone doesn't really matter because 99% of our testosterone is bound to proteins in the blood, such as sex hormone binding globulin or SHBG, which renders it completely useless. So for testosterone to have any biologic effect, it has to penetrate through a cell membrane. It binds to an androgen receptor, which then takes that testosterone into the nucleus of the cell. And that's where DNA transcription occurs. And obviously RNA and then proteins get produced as a result of that testosterone. So, reminding people of the biology of how physiology of how everything works. If testosterone can't get into the cell, it doesn't do any of that. It doesn't have any effect. And so free testosterone is what we care about, not total. So often doctors are just looking at total. Free is what we care about. And a general ballpark number that I want people to focus on is 20. A free testosterone of 20 is our general broad strokes target. Now, for some
Is that for
guys,
men of all ages?
for all ages,
Mm-hmm.
absolutely for all. And younger guys are already at 20. As
Right.
we get older, we're seeing this more often. But I swear I've seen guys in their 20s and 30s that have free testosterones of 6. I have 2 NFL wide receivers. Actually, well, one of them just got cut a few weeks ago, but I have 2 NFL wide receivers who have been both recently playing in the NFL, and their free testosterone levels were 6. Crazy.
I'm seeing that more and more. I do fertility work, and
Yeah,
also with Dutch, we see so many tests
yeah,
come through with androgens and androgen metabolites, and we
yeah.
hear from providers all the time that they're seeing very young men with
Hmm.
really low free testosterone.
Yeah. And this is the testosterone epidemic I talked about in my TED Talk. I'm talking about, how endocrine disruptors are crushing our health. It's the microplastics, but it's the BPA, it's the phthalates, it's the synthetic soy, it's all of these chemicals in our drinking water. Synthetic birth control estrogen is in our drinking water. We have chemicals sprayed on our crops, herbicides, pesticides that we're eating. Our animals, if they're not grass-fed organic, you're eating the chemicals that they have eaten. Our personal care products, our deodorant, our sunscreen, our cologne. I mean, not cologne. Don't ever use cologne, guys.
Yeah,
Our
all the cologne for sure.
yeah, hold anything with scent, anything that has full of phthalates. Our laundry detergent, our soap, our shampoo, our sunscreen is loaded with these chemicals that is having a compounding effect on our hormones. It's causing endocrine disruption for men. That shows up as low testosterone, infertility, ADD, precocious puberty, hormone-driven cancers. It's a big deal, and I'm so glad that RFK and others are finally bringing this to people's attention. Kaylee Means pointing out how we need to start paying attention how these chemicals are crushing our health. So that's a big driver,
Mhm.
I believe, why we're seeing such low testosterone levels.
Yeah, my poor husband, I like think of him because he's like a conventional guy.
Yeah.
We met in our, he was in his 40s, and all of the things that he had done in life. I'm like, no, you shouldn't use this. You shouldn't do
Yep.
this. You should get organic. And he's
Yeah.
actually a convert now, and
Yeah.
is always sending me new research. But it
Yeah.
makes such a big difference, and it really transformed his individual health,
That's awesome.
paying more attention to it. But as a global
Yeah.
problem, it's
Yep.
huge. It's
The
so
little things
huge.
are big things. Yeah.
Absolutely. Well, because there's so
So
many, right? It's like drops in a bucket, but you have thousands a day, so it absolutely can
it's
fill up.
yeah, and it's little micro decisions every day. You look at how the little things you're doing every day. Like, I have right here my stainless steel water bottle with filtered water. Like prepare for, instead of having plastic water bottles on the fly because you need water, and like you make little decisions so that you're set up for the day. So
Mhm.
you're not using plastic cups for your coffee. You're not using K cups, that have plastics that's leaching into your coffee. If you're making it, you're using stainless steel, you're using glass if you're storing your foods. Like, these little decisions add up over time for sure. Yeah.
Mhm. Yeah, absolutely. The pans you buy and cook at home, there's so many. We could have a whole nother podcast on this. Maybe
Right?
we need to.
Yeah. So
Little
that's
panel.
testosterone. Another hormone that guys don't pay much attention to is DHEA. So DHEA, specifically DHEA sulfate. I know on the Dutch panel, it's a big deal. We look at DHEA. DHEA is important because it regulates mood, energy, metabolism. It's important for regulating cortisol. And there's a big deal for a lot of the high performers I work with, cortisol, stress, and they'll always say, I'm not stressed. Well, nonsense. We can actually measure and prove you are stressed. But DHEA helps balance and regulate cortisol. And so DHEA sulfate is a big deal. And especially when guys are supplementing or taking TRT, testosterone replacement therapy, DHEA is a precursor to testosterone. And so what a lot of times happens, especially in men, is we'll see very, very low DHEA levels because they're on testosterone replacement therapy. Another cause of that is gut issues. So malabsorption. So a lot of guys will be taking DHEA supplementation and their levels don't budge. That sulfation process, as you know, as any functional medicine practitioner knows, that sulfation process depends upon normal gut function. And so this is why it's so important that we look at everything, how it's all interconnected, how gut health can regulate this. But DHEA sulfate is an important lab for guys to be checking as well. You want your level meant to be between 300 and 600. I see a lot of guys, DHEA is like 50, 60, 70, very, very low. So that's DHEA. The other one I'll bring up here that's important is thyroid. Now, thyroid is important for men and women. A lot of people think it's just a woman's hormone, but men need it as well for metabolism, for energy. It's important for hair, skin, nails. It's important for hot, cold tolerance. It's important for a lot of reasons in men. It mimics testosterone in many ways. So guys need to pay attention to thyroid. TSH, however, is what your doctor is probably checking, and TSH is completely worthless. TSH is completely worthless. It's simply the signal from your brain that tells your thyroid to make thyroid hormone. Now, yes, there's this negative feedback that will turn it off when your thyroid levels go up. But TSH tells the thyroid to make T4, and then T4 has to get converted into the really active, biologically, physiologically active form of it, which is T3. And so the real thyroid hormone that every guy should be checking is free T3. And your target for that is somewhere around 4, give or take 3.8 to 4.2 or so, call it 4, is where you want to be. So free T3 is the key lab you want to be checking for thyroid. But the other one that most doctors don't know about, and I know most functional practitioners know about this, is reverse T3. And reverse T3, I like to say, is the evil twin brother. It's the anti-thyroid. It blocks your thyroid from doing its job because it will bind to that same receptor and block thyroid from doing its job. And so you need to be measuring reverse T3 as well. You want that one to be very, very low. And if it's high, you need to ask the question, why? And that's part of step 2 when we do a deep dive of understanding why that marker might be off. But typically it's gut, it's toxins, it's nutrients, it's stress, something causing that conversion of T4 into reverse T3, which you don't want. Again, you want high T3. So that's thyroid. We have 50 hormones we look at, but those are some of the bigger ones that I would focus on.
Fabulous. So after diagnostic testing and serum workup, what are next steps for a patient?
Sure. Yeah. So the next step is, I call it deep dive. Step 2 is deep dive. And I like to say test, don't guess. And so when we see abnormalities on the blood testing, the next question is to ask why. And so this is where I love using the Dutch test. It's great for women. It's also great for men as well. I love looking at gut testing, microbiome testing. So GI map is the one that we use. GI Effects is a great one as well. I love looking at food sensitivity testing. So a great story I love to tell is one of my clients, Marco. He's a race car driver, and he came to me many years ago because his decision-making was off. He felt like when he was going around the track at 200 miles an hour, he felt like he wasn't able to take the turns like he used to. Like something was just not right.
I can see why he'd be in your door. That's a
big deal, right? Pretty important, right?
Clear thinking.
Yeah. And so we found a lot of stuff to work on, of course, but one of the biggest things for him, the biggest drivers of change for him was when we did his food sensitivity testing, we found that he had sensitivity to bananas and coffee. Of all things, bananas and coffee.
Wow.
And guess what Marco was having for breakfast every day before we did that test?
Bananas and coffee,
among other things as well. But when he stopped, we had to obviously do some gut work, clean up his gut and replenish his microbiome and fix his gut integrity. So some other issues at play as well. But when he stopped bananas and coffee overnight, he said a light switch went off. He was already on testosterone and thyroid. He was doing all these other things that were in play. But once we made that one change, he said a light switch went off. And suddenly his mental acuity, his reaction time, everything changed. And he was like, holy crap, this stuff works. And he said everything changed. And true story, no lie, he goes on and he sets a world record for endurance race car outcome. And I don't even know what the event was, but he has a Guinness World Record now for endurance racing that he really attributes to the fact that he was able to find these little things that are big things that make all the difference in the world.
Yeah, I
And so
mean,
that's
I
why.
think gut health is like such an important thing. When you talk about food reactions, I mean,
Mhm.
really, inflammation has its home in the gut. So
That's
anything
right.
that's triggering that, it's not surprising to me that he had such a huge impact from that reaction. I mean, we see that so much in patients, and people don't really think to look there first, although they're starting to look there first.
You're exactly right. And it's amazing to me still how the gut is connected to everything. It affects neurotransmitter production in the brain. So it affects mood and energy. It affects metabolism. It affects hormone production. It affects immune system. And I think it's ultimately tied to longevity for all those reasons. And so when we see signs of systemic inflammation or even blood sugar issues, weight gain, you know, it's in the gut. Great story here. So people talk about semaglutide and this amazing peptide, how incredible it is to lose weight. Well, we all have a natural semaglutide that we make in our own bodies, and it comes from the gut. So to be clear, the L cell is a type of cell in our gut that produces GLP-1. So instead of injecting semaglutide, which is a great peptide, don't get me wrong, our bodies actually make that when our gut is intact and healthy and the L cells are working properly. Guess what the L cell needs to function properly? Akkermansia, a
Mhm.
key cornerstone bacteria. So this is why the microbiome is so important. It affects everything. And a lot of people can't lose weight because of the gut. And so you're
Mhm.
exactly right that a lot of things trace back ultimately to gut health.
Yeah, it's fabulous that we're starting to pay attention to it as its core foundational piece of health and longevity. And I'm actually seeing that trickle into conventional spaces too. Interestingly, my son was diagnosed with type 1 diabetes maybe it's 2019, so almost 5 years ago. And at Boston Children's, the first thing they told me as a parent was, "We really think this comes from a microbiome imbalance in the gut that probably happened very early on." And I was actually shocked because, we know autoimmunity starts in the gut, but to have it from a conventional endocrinology
Hmm.
hospital
Yeah.
physician was a big surprise
Yeah.
and a really nice surprise.
Yeah. Great story around that. One of my clients, his teenage son, he was 12 years old at the time. Now he's, I think, 16, 15, 16. At the time, he was having recurring sinus infections to the point that he kept going to ENTs and he was on all different antibiotics that weren't working and he's developing resistance and this and that. And I casually just said, Ken, it's coming from the gut. And he's like, no, it's the sign, not the gut, doc. I'm like, it's the gut. And he's like, and he wouldn't believe me. I'm like, okay, I'll prove it to you. I'll take care of your son. I'm not a pediatric ENT, but I know that recurring infections, sinus infections, UTIs, prostatitis, a lot of it comes from the gut. Sure enough, Noah had massive issues in his gut. And when we treated it, his sinus infections are gone.
That's
Literally gone,
unbelievable.
haven't come back again. He was dealing with that since he was a child, and they're now gone. And it all came from the gut. Fascinating.
That's awesome.
Yeah.
So, when we look at like high performing individuals, and they come into you and, they think everything's perfect and, they have some underlying challenges. When you look at the lifestyle factors that have influenced those changes over time, like stress or maybe sleep disruption, overtraining, are there patterns that you've seen that we should be aware of, ourselves, like as far as those underlying root causes?
Sure. And there's a lot wrapped around that. We could spend hours talking about all the lifestyle stuff but I'm going to focus on one that I think is so common, and that is sleep. So, one of the biggest triggers for stress in our body is poor sleep. And when I used to ask guys, do you feel like stress is an issue? They all say, I quit asking because they all say no. But poor sleep is one of the biggest triggers of stress. And we can see that because when you have a fasting blood sugar that's elevated, think about this. You haven't eaten. And so, how the hell is my blood sugar higher than 90? Why is it 112? Well, cortisol, our stress hormone, has raised your blood sugar because that's what cortisol does. Well, why is my cortisol level high? Well, that's stress. Why? And so, poor sleep is one of the biggest triggers for that. And so, and poor sleep begets stress, which begets poor sleep. So, it becomes this
Mm.
vicious cycle as
Yeah,
well.
it's cause and effect with
It
sleep, I
does,
think.
exactly, yeah. So a lot of it is intentional. A lot of it is guys will stay up late. They will either be working late or they'll be on Netflix until 12:30, and then they're up at 5 or 5:30. And some guys, I'll tell you that they'll work till midnight and they're up at 5 to go to the gym. And a great story with Sean. He's this beast. He looks amazing. He's eating chicken and rice every day, and he's in the gym every day, and he looks incredible. He's in great shape, and remarkably, his lipids are actually pretty darn good. His markers of inflammation aren't that bad. His calcium score, which is another one of the deep dive tests that we do to better understand cardiovascular health and risk, his calcium score, which is a simple CAT scan of the heart, looking at calcified heart plaque, it should be 0, especially for a 36-year-old guy like Sean. It was 212.
Wow.
And so, great example of how stress can trigger cardiovascular disease as well. And for him, that stress was overtraining and sacrificing good quality sleep.
Yeah, it's
And
interesting because I think that when you see on the Dutch test, when you look at the cortisol diurnal pattern, you really can get a lot of information from
yeah,
that. Like one of the things our team constantly says is when that morning cortisol is elevated, usually we're like, have you checked blood sugar? Because the most common pattern is elevated blood sugar through the night, which keeps cortisol elevated. You never
that's right.
actually get to that resting state,
That's right.
and I think you're right. When there's sleep disruption,
Yeah.
cortisol disruption, it's really hard to heal.
Yeah. So I'll see that a lot of times where guys will stay up late, wake up early, intentionally sacrificing sleep because behavioral, their nighttime routine is not where it needs to be. So some of that's sleep hygiene kind of stuff. But a lot of times I'll hear a story of, I went to bed at 11:30, and then I woke up at 2:30, and then my mind is going and I can't turn it off and I'm done. Night's over. Took me an hour and a half to fall asleep again, and the night's ruined. And that is what you said, which is stress affecting sleep. So it becomes this ugly, vicious cycle to where it's now disrupting sleep, which further perpetuates the process. And so that happens a lot. And then what happens is the whole day you're tired, you're grumpy, you're not making smart decisions. So now you're not going to eat the right foods. You're not going to pay attention to the little decisions that really matter. You're not going to be drinking enough water because you're so stressed out. You're just drinking coffee instead, which I love my coffee as well, but you need to be sure you're getting hydrated. You're not making the good food choices. You're not working out like you should. Everything gets disrupted. The other big part of that ties into what we talked about a few minutes ago is that cortisol elevation goes to the gut. And one of the worst downstream consequences of chronically elevated cortisol is it crushes our microbiome, crushes our gut wall, crushes integrity, crushes the secretory IgA, which protects our gut. Next thing you know, you end up like Marco with a bananas and coffee story. And so that's how everything is all interconnected.
Yeah, we see that a ton. And even like SIBO, most of the time SIBO infection is directly following an acute life stressor in people. Almost always you can trace it back. I love that you brought that up because the connection between stress and gut health and then gut health and everything else is so huge. Great. Well, really your research and your work in your clinic really connects the dots between kind of lifestyle, longevity, heart health, personalized medicine, like really using science to tailor an approach to really helping people live the maximum life expectancy, but life expectancy with capability and joy and, being present in life and really being able to utilize it. Now, with your approach to longevity and anti-aging at the Gapin Institute, how does it incorporate heart health? Is that the cornerstone piece of it, or is it a piece of a whole systemic approach?
That's one piece of a much bigger approach. And when it
Okay.
comes to the data we talked about, or the diagnostics and the data, it comes to the deep dive. Cardiovascular health is a big focus so that we can understand what do we need to address. Because again, people talk about longevity. It's this hot phrase all of a sudden. And when I think of longevity, I don't have any false expectations that you or I are going to live to 150. I think it's BS. It's nonsense. I think it's unfair. It's a little extreme. Can we live to 100 and be healthy and have the best quality of life that we can and be the best version of yourself? And yes, I think that's possible. So to me, longevity is about, how can I achieve peak performance? And to me, peak performance, to be very clear, peak performance is not competing in an Ironman. Peak performance to me is to being the best dad I can be to my incredible 11-year-old boy now and 9-year-old daughter. That's what it's all about to me. How can I show up and be a present and engaged leader in my community, leader to my team at the Gapin Institute, leader to my patients? And if I can do that till I'm 100, that's what longevity is really all about. And so I want to be clear, when we use these phrases, that's what longevity is. And so peak performance means putting all these pieces together. It's optimizing cardiovascular health, it's optimizing metabolic health, blood sugar regulation, optimizing hormones, getting your gut fixed, taking care of all these pieces that ultimately affect your performance on a daily basis. And then I think the big part that's missing in traditional medicine is, we put all these pieces together and build this foundation. How do you know that what you're doing is actually working?
Mm-hmm.
And so what's the data? What's the metrics? What are the KPIs? In business, they use a term KPI, key performance indicator. No one in health has metrics to track if what you're doing is actually working or not. They just look at lab. Yeah, your labs are better. You're doing great. I'll see you in 6 months. And so I'm a big believer in data. So everything we do is data driven. So whether it's using wearable technology to track sleep, to track blood sugar, blood sugar monitors, CGMs are not just for diabetics anymore. So we can understand if what you're doing is actually working. Are you eating the right foods? We didn't talk about this much, but the genetics can help us understand, are you eating the right foods, the macro ratios? Are you taking the right supplements? But then everything you're taking, everything you're doing, you can measure to see if it's actually right for you. And that's where I believe everything needs to be data driven so that, I say know your numbers to know if what you're doing is actually working. And that's what I think is really missing when it comes to peak performance and longevity and, this new cutting edge world of medicine.
Fabulous. So I think my last question is just like, as we look to the future, there's so many developments happening in the field of health and longevity.
Yeah,
What are the top things that are really getting you excited, or research you've seen that you say, I can't wait 5 years from now, we're going to know so much more about this and it's going to be a
sure.
game changer?
Yeah,
What are those things that have really lit you up?
yeah. I love peptides. I'm a massive believer in peptides. They're incredible molecules. However, I want to put a big asterisk on this because there are a lot of, I believe, I'll call them predators to be very direct here, who are out there selling you a big stack of peptides as the magic cure for all. I like to think of peptides as the icing on the cake. You bake your cake, gut health, hormones, nutrition, cardiovascular health, metabolic health, everything else. That's your cake you built. The icing on the cake are the peptides. You don't go to the grocery store and get a can of frosting and just eat the frosting out of the can. It doesn't make any sense, right? It's sweet and it's good, but it doesn't make sense unless it's on the cake. And so that's the analogy I like to use, that I love peptides in the right context. And so I think peptides are part of really the future of medicine and longevity, and the science around peptides is incredible. I think some treatments like plasmapheresis is something that's not talked about very much.
Mm,
Plasmapheresis is incredible for clearing toxins. It done in the right way, apheresis can clear microplastics. It's one of the only treatments for that I mentioned earlier, LP little a. It's one of the only treatments that has really been shown to be effective at clearing LP little a. So that might be a really cutting edge
mm.
indication for plasmapheresis. So I love that as well. The advanced diagnostic testing that's coming out is really on the forefront, and new cutting edge functional tests are really amazing how they're helping us really innovate. And there's cutting edge science every day that we're having to keep track of, right? NAD, I'll give you one more piece here. NAD, everyone thinks NAD is the future. I'm going to be going against the grain here and tell you that taking NAD or NAD precursors is actually not what you want to be doing. Now, most people are like, what the hell? I'm doing NAD drips. I'm taking NR and NMN and
Right.
all this and Peter T. And
Yeah, the first I've heard say that. I'd love to know
yeah,
more.
yeah. And Sinclair is out there selling. Well, I'm going to go against all that and explain why. So as we age, we know that NAD levels are not declining for lack of production. It's not our body doesn't make NAD anymore. It's the breakdown process is happening at an exponentially higher rate.
Mm.
And so there are molecules that help affect that, which is so much more impactful than just taking NAD precursors. And we know that NMN or NR supplementation has been shown to be associated with people who have undiagnosed cancers of promoting cancer growth. And so in the right context, NMN, NR may be helpful, but it could actually be harmful for you as well. So
It
there
makes
are
sense. It's like they're so helpful for cellular health that it would be all cells, not only healthy cells. Yeah.
there you go. Exactly right.
Yeah.
So
And
the
just so
cells that
people are, if you're new to it, NR is nicotinamide riboside and NMN is nicotinamide mononucleotide, which
thank
are
you.
kind of
Yeah.
dietary supplement ingredients. So you can
Thank you.
look up
Yeah.
and research
Yeah.
yourself on that too.
So sorry. Yeah. These are precursors to NAD. And a lot of people take these as the way to increase NAD levels in our body. But I'll caution people against that the cutting edge science is telling us that molecules like 1-MNA, 1-MNA is a better approach with apigenin, for example. There's nuance and context around this, but
Mm-hmm.
that's a better way of affecting that degradation breakdown pathway, which is a much better way to raise NAD levels than trying to flood yourself with more on the front end. And so
Mm-hmm.
that's the nuance around how there's these influencers and these these predators out there trying to sell you stuff that may not be right for what you're trying to do. And so
Yep.
I think the future of health is really all about basing it on science and not letting the influencers and the salespeople out there trying to really control the narrative.
Yeah, definitely. Well, I've appreciated what you've shared with us, the science that you've leveraged in the clinic and your personal experience. I'm really grateful for you coming on today, Dr. Gapin, and look forward to hearing more from you in the future.
You got it. Thanks so much.
Thank you. If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.